Are you expecting or have had a total hip replacement? Worried about what the first stages of rehab may look like, how to control the pain, and what to do and maybe what not to do? Follow along with the rest of this video as we aim to answer all those questions. So what's the need of this video? Well, I'm finding in clinic a lot of patients that come a week post-op really haven't got a clue as to what's gone on, why they're in so much pain, and probably what they should have been doing for that week before they come to physiotherapy. So hopefully this will give you the tools, whether you've just had an operation or expecting one in the future, of what you can do to manage in that first week. So what have we had done? This is what our normal hip looks like, our biological hip. And here's one I prepared earlier. This will be what your new hip looks like. We have our socket, which will be titanium, replacing the socket. And now we've got a new titanium shaft that's been placed into the femur that replaces the head here. So this allows that restoration of movement and function, okay? Now, oftentimes, I get a lot of patients that just don't quite understand why they're in so much pain. There's two reasons. Number one, you can quickly find out by having a little Google or having a look on YouTube as to what the process of the operation of a total hip is. Don't have your breakfast before it, or if you're queasy, just don't watch it, because it's a thing of beauty to watch, okay? So you may understand after you watch that why you're in pain. And another more serious reason is to get to the hip joint, they will have had to obviously surgically open you up, and they have to cut through tissue. Now the surgeons will take one of three approaches, either anteriorly, laterally, or posteriorly. And the most common that we come across is the lateral approach. Now we're not going to get bogged down with what surgeon does what and why we would do another one today, but it's important to know that certain aspects will have different restrictions. We'll talk about that a bit later. So the main thing though is you have been surgically incised, you've been opened up and stitched back together. That is another cause of your pain, obviously. And the nice thing I tell my patients is we heal from in to out. Much like any scab, you'll heal in all the way to the top layer. So it's a really nice clinical indicator of where your healing is, why you're in pain. If the top surface of that scar still hasn't fully healed, it's a really safe bet that that's why a little bit deeper down, you may not have fully healed either quite yet. A really nice indicator for you to watch to see why that pain is still present. Pain management. Another big key area in our rehab, particularly post-op, is trying to get ahead of the pain as we can. Now, why do we want to do that? Well, number one, pain is painful and your body will move away from it. The other thing as well, what pain causes, which is very interesting, it causes inhibition of the muscle. So literally the muscle will not contract the way that we want it as the pain is stopping it from doing that. Maintaining that weakness and kind of going against a lot of the things that we're trying to do, i.e. build up the muscle and restore function. Now, there's a few things that we can do that are really simple to get in control of our pain. Number one is taking your pain medications. Taking them as prescribed, regularly, not as and when. If our pain creeps up too far, again, it can kind of just make us feel grotty, not sleep, and inhibit our recovery a little bit. We've already touched on it, but sleep. Don't be afraid to sleep a little bit more. Have more naps. Look after your sleep health. That is when we recover the fastest, when we're sleeping. The other thing as well, which is nice and easy, is our trusty cold therapies. So ice packs, whatever. You don't have to buy anything fancy. Get some ice on there. Make sure you're not ice to skin. We don't need an ice burn on top of all of this as well. But again, 10, 15 minutes just to ease off that little bit of pain. It can give you some nice relief. And another thing we don't talk about probably enough in physiotherapy is healthy habits. Are you eating Domino's every night because you feel rubbish because you've had a big op? Probably not the best thing for you. So I'm not asking you to eat like a rabbit, but it's more having enough protein, having enough veg, trying to stay off loads and loads of alcohol. And if you can, stay away from our smoking, as that does really inhibit our healing. So with all those things in mind, hopefully we'll just start to manage our pain with the view of building up that muscular strength to restore that function as quick as possible. So let's touch on hip precautions. So these are just precautionary movements that your surgeon will tell you to do in the first 6 weeks just to try and protect that hip as much as possible, okay? Now, as a caveat, these are generally for our lateral approaches, not the anterior or the posterior. So ask your surgeon what your precautions are. Some give them and some don't. So here they are. Number 1 is trying not to flex the hip above 90 degrees. That can be in standing or in sitting, okay? So I get a lot of patients that are petrified to sit because they're trying to work out the angles. We don't want patients to fear movement. It's just a precaution. If you sit 5 degrees over the 90, chances are you'll be fine. Number 2 is crossing the midline. And number 3 is rotating that hip either side. Again, these are precautionary movements. If we do them once, our whole rehab is not failed. I really need to hammer that home with you all. Okay, so lastly, to finish off, I'm just going to give you a few exercises that you can be doing regularly at home in that first week, just so when you get to us, you've been moving, you're not fearful, and hopefully you'll have increased the range of movement at the joint, which is our first goal, is to get within the precautions that we can hit or get as much movement as possible within reason. First exercise, so you can do this in bed. Obviously you won't be in shoes, that's a bit weird, but you're going to slide that hip up and down. Now again, it probably won't look as smooth as this. It may jerk, it may slowly move as the muscle, again as we said, has been inhibited. But the more you do it, the smoother this will get. Now as a little step up, if you're feeling brave, you can hook a towel around and you can just help it up and back down. Help it up, again, going within those hip precautions if you have any. Good, so that's hip flexion. Number 2 is hip abduction. So we're here, we slide out and in. This may be harder, as again, most of us have that lateral incision. These muscles that control this will be working. Good. To there. And again, these aren't going to win the most fun exercise of the year award, but they are effective. We've got to get you moving. You'll also generally feel a little bit better after moving as you kind of flush around that swelling a wee bit. Lastly, in the bed, I want you to picture you've got $50 between your bottom. It's a very windy day and you're going to squeeze that bottom hard. Don't let the $50 go and relax. And again, squeeze hard and relax. And finally, if you're feeling that little bit brave before you come into the clinic, we can try a squeeze and a little lift, 2, 3, and down. Really working our bottom muscles again. Squeeze, 2, 3, and down. And one more. Squeeze, 2, 3, and down. Brilliant, those are our bed exercises. So the final exercises you can be doing in standing. Now again, whenever we weight bear through that hip, that is great therapy. We are loading the tissue, we are then increasing that strength. So I call this, well in the UK I call it the cup of tea workout, but in Canada it doesn't really apply. We're going to call it the cup of joe workout. Okay, so whenever you get up, click the kettle on, you can be doing just a little set of exercises as a kind of habit. Over the first week, you'll be doing quite a lot of these, hopefully, as pain allows. So, exercise 1. We've done these in the bed. If you feel like you can do the hip abduction, you're more than welcome to do that in standing. What's nice is we de-weight our arms with our kitchen counter. Next exercise is again your hip flexion, but in standing. So you can have both hands on, or you can have another bit of support. Again, this is fantastic. Trying to get that hip up and moving. One that we couldn't do in the bed was our hip extension. So you're going to come back, squeeze your bottom and forward. Squeeze your bottom and forward. Really trying to get this bottom muscle firing again. And finally, a little bit different, we're just going to side step. So this is nice as we weight bear through this leg. We're going to come over as if we're hurdling something. Just making sure we're nice and safe at our kitchen counter, backwards and forwards. And the best thing is, we can reward ourselves with a cup of joe. So, thank you very much for watching. I hope this has been really informative and given you just some insight into what's gone on at the hip post or pre-operation, what to expect and how to manage your pain, and actually setting you up really nicely for when we see you in the first couple of weeks, so that you can say, I've been doing X, Y, and Z, and then we can really push you on and start training you towards your goals that you want to achieve. Thanks very much. Catch you soon.